Ladies and gentlemen, welcome to sample videos of Wincap Academy, where the curriculum is designed to your personalized needs. Now, in forensic medicine and toxicology, next sample that we're going to be doing today is thermal injuries. Now, what exactly are thermal injuries? Thermal injuries are any injuries which are caused due to the application of heat or cold to the tissues of the body. Yes, it is either heat or it is cold. So it can be a very hot-headed case like that of Mr. Ghost Rider, or it can be the cold touch of Mr. Freeze Arnold Schwarzenegger. Now both these scenarios can cause injuries which are known as thermal injuries. Now heat can cause, apart from burns, can cause conditions which are like heat hyperpyrexia, heat cramps or minus cramps. Now these are cases wherein the heat has caused electrolyte disturbances in the body, or it can cause scalds, which is moist heat, or it can cause burns, which is dry heat. Cold, on the other hand, does cause its own share of problem. Now you have scenarios like trench foot or immersion foot, wherein the cold, the damp together mix up and wreak havoc on the body. You also have a dry cold condition known as frostbite. Now we're going to be looking at all of them today in this particular presentation. First is trench foot or immersion foot. Now as the picture is showing you, trench foot or immersion foot basically is a condition wherein the extremities are exposed to a lot of humidity and a lot of cold. What this does is it causes initially epithelial damage to the superficial layer of the skin, which leads to the skin being peeled off, and eventually it can even extend to a condition wherein amputation of the toes or extremities such as fingers can occur. This condition was initially found in soldiers. That's right. So it was initially soldiers in the World War who used to dig trenches. Now trenches are holes in the ground in which they used to go and they used to stand guard. Here, because of the various environmental conditions like snow or rain, they used to be exposed to both cold as well as a lot of humidity, leading to a condition like trench foot or immersion foot. The second aspect that we have to look at as far as cold injuries are concerned is known as frostbite. Now frostbite is a condition that occurs due to dry cold. That's right, there's no humidity as such involved here. Now this is something very commonly seen in individuals who are involved in mountaineering. That's right. If you guys remember, mountaineering legend Bachendri Bal, the Indian woman to scale Everest, was also subjected to this particular condition. Now frostbite is when you are exposed to the environment at a very high altitude with lots and lots of cold. Generally it affects the terminal appendages of the body such as the nose, the ears, the fingers and the toes. Frostbite generally occurs when we are exposed to a temperature that is minus 2.5 degrees centigrade or below. So yeah, it's very cold. The pathogenesis involves two specific entities. First, vasospasm, which leads to a decreased blood flow causing hypoxia as well as ischemia. Now both of these things together cause damage to the skin, leading to specific features like cold skin, erythematous patches, which are generally seen over distal, that means terminal, and exposed parts such as ear, nose, fingers and toes. Frostbite generally starts at the terminal end and it tends to progress centrally. That's right. So it starts outer and it progresses centrally. This is generally a condition which is easily treatable, but if the treatment is not given on time, it can cause specific necrosis leading to amputation. So yeah, if we get a case of frostbite, we have to ensure that the circulation is restored as fast as possible. Thank you. You need more? Come down to Wincap Academy and we'll give it to you in an organized manner. Thank you.